CPC Exam Prep Mastery. Stop worrying about your coding exam because I have the best tips for you to pass on your first try. These questions come with full explanations, which will help you get your certification on the first try. Medical coding is the way that we tell a story about a patient using numbers and also some special letters. You need to know that insurance companies use these codes to decide if they will pay the doctor for work. In the year 2026, the rules for coding have changed just a little bit to make things much easier. You must learn how to use the ICD-10CM book to find the right sickness for every single patient. The first thing you should always look for is the chief complaint, which is the main reason for the visit. Doctors also use captain codes to explain the exact medical procedures that they performed during the office or hospital encounter. You will find that coding for evaluation and management is the most common task for a new professional medical coder. In 2026, you should focus on the medical decision-making or the total time spent with the patient today. This means you do not have to count every single body system during the physical exam like in old years. You should also know about the HCPCS Level 2 codes, which are ever things like wheelchairs, special drugs, and even some ambulance rides. When you take the exam, you must be very fast at turning the pages in your big coding books very quickly. I will teach you how to use the index and the tabular list to make sure you never pick the wrong code. Every code has a specific set of rules, and you must follow those guidelines to avoid making any big mistakes. The ICD-10CM book is organized in a way that helps you find the code starting with a letter and then some numbers. You must always check the tabular list after you find a code in the index to be sure it is totally correct. Sometimes you will need to add a seventh character to the code to show if this is a new injury or old. These special rules help the insurance companies understand if the patient is getting better or needs more help right now. Captain codes are 5 digits long, and they help you describe things like surgery, lab tests, or even simple office visits. You need to learn about modifiers because they add more detail to the code without changing the main meaning of the work. For example, if a doctor does two things at once, you might need to use a special modifier like 50 to show both sides. In the 2026 exam, they will ask you many questions about how to use these modifiers in the right way. Evaluation and management codes are the most tested part of the exam, so you should spend a lot of time learning them now. You must understand the difference between an office visit and a visit in the emergency room or the hospital ward. Each place of service has a different set of codes, and you must pick the one that matches the record. If the doctor spends a lot of extra time, you might need to use a special code for that extra work they did. Medical coding is not just about picking numbers, because you also have to understand the rules of the whole healthcare system. You should know about HCPCS because it keeps the patient information safe and private from people who do not need to see it. If you break these rules, you could get into big trouble and lose your job, or even have to pay a very large fine. The exam will ask you about these laws, so you should read the rules very carefully before you go to the testing center. You should also learn about the NCCI edits, which are rules that stop you from billing for two things that should be just one. This is called bundling, and it is a very important part of being a good coder in a big office. If you try to bill for every little piece of a surgery, the insurance company will say that is not the right way. You must follow the guidelines in your CPT book to see which codes already include the other smaller parts of the medical procedure. When you are studying for the exam, you should practice with a timer so you can get used to the fast speed of the test day. You have to answer many questions in a short amount of time, so being fast is just as important as being correct today. I like to mark my books with tabs so I can find the right sections and the right chapters very easily and very fast. You can also write small notes in your books to help you remember the most important rules for IT code in the whole manual. The 2026 guidelines say that we should focus on the quality of the care instead of just how many things the doctor did today. This makes coding a bit more about thinking and a bit less about just counting things on a long list. You will need to read the doctor's notes very well to see if the medical decision making was easy or if it was very hard. Harder decisions mean that the code will be a higher level, and the doctor will get paid more for the work they did today. You also need to understand how to code for chronic diseases like diabetes or high blood pressure when the patient comes in for something else like a cold. These diseases are called comorbidities, and they can make the coding more complex than a simple visit for a healthy person would be. You should always list the most important reason first and then add the other conditions if they affect the care the patient gets today. The order of the codes is very important for the insurance company to understand the whole story of the patient's visit to the doctor. Train, test, we need to fix, repeat. This is the best way to learn how to code because you will make mistakes at first and then learn how to fix them. Do not get sad if you get a question wrong while you are practicing, because that is how you will learn to be better. Every mistake is just a chance to see what you need to study more before the real exam starts in the year 2026. Keep practicing every day, and you will find that the codes start to make much more sense to you very soon. 1. What is the first thing you should look for in the medical record to find the diagnosis? You must find the chief complaint, which is the reason why the patient came today. The chief complaint helps you find the main diagnosis code that explains the medical necessity for the entire visit. 2. Which manual do you use to find codes for a broken bone or a flu? You use the ICD-10CM book, which is for all the different types of sicknesses. This book contains all the diagnosis codes that doctors use to track diseases and health problems for their patients. 3. What are captain codes used for in a medical office or a hospital? They are used to describe the actions and the work that the doctor did for the patient. CPT codes tell the insurance company exactly what procedures were done so the doctor can be paid for the work.
4. If a doctor sees a new patient for the first time, what type of code do you use? You use a CPT code for a new patient evaluation and management visit in the office. New patients require more work and more history taking than patients the doctor has already seen in the past. 5. What does a modifier do to a medical code in the CPT book? It gives more information about the procedure without changing the actual code or its main meaning. Modifiers explain if a procedure was done on two sides or if it was done more than one time. 6. Which code system is used for things like crutches or a new wheelchair for a patient? You use the HCPCS Level 2 codes for equipment and supplies that are known in CPT. This book covers items that are used outside of the doctor's office or special drugs that patients need at home. 7. In 2026, what are the two main ways to pick an evaluation and management code level? You use the total time spent or the level of medical decision making for the patient visit. The 2026 rules made it simpler by removing the need to count every single part of the physical exam. 8. What is the rule for coding a diagnosis that the doctor says is possible or probable? In an office setting, you do not code it and you code the symptoms instead today. You can only code a confirmed diagnosis in an outpatient clinic to make sure the record is totally accurate. 9. What does the term unbundling mean in the world of professional medical coding? It means breaking one code into many small parts to try and get more money unfairly. Unbundling is against the rules and you should always use a single code if it covers all the work. 10. When should you use a Z code from the ICD-10-CM manual for a patient visit? You use Z codes for things like checkups or when a person is not currently sick today. These codes explain the reason for a visit when there is no actual disease or injury to report. 11. What is a global period when you are coding for a surgery or a procedure? It is the time after a surgery when the doctor cannot bill for normal follow-up visits. The price of the surgery already includes the doctor checking on the patient for a certain number of days. 12. How many characters can an ICD-10-CM diagnosis code have at the very most? An ICD-10-CM code can have up to 7 characters to be as specific as possible today. The extra characters help show if the visit is for a new problem or a follow-up for later. 13. What is the purpose of the NCCI edits used by the insurance companies and the coders? They are rules that show which codes can be billed together and which codes cannot be together. These edits prevent errors and stop overpayments by making sure the coding follows the standard medical guidelines. 14. What do you call the list of codes at the end of the CPT book? That part of the book is the index and it helps you find the right page fast. You should always start in the index and then check the tabular section to find the perfect code. 15. Why is the place of service code important for a medical claim form? It tells the insurance company where the doctor saw the patient, like a hospital or office. The amount of money paid can change depending on if the work was done in a clinic or hospital. 16. What is a sequela code used for in the ICD-10-CM diagnosis manual? It is used for a late effect or a problem that happened because of an old injury. You use these codes when the main injury is gone but a new problem is started because of it. 17. What should you do if the medical record is missing information for a code? You must ask the doctor to add more details to the note before you pick a code. This is called a query and it is the only way to make sure the coding is legal. 18. What is a Category 2 CPT code used for in a medical office? These codes are used to track the quality of the care that the doctor is giving. They are optional codes that help show if a doctor is following the best steps for the patient. 19. In 2026, how do you code for a patient who has both a cold and asthma? You code the cold as the main reason and then add the asthma as an extra. Adding the asthma shows that the patient's health is more complex and might need more time and care. Please leave suggestions in the comment section to improve. To get the full course, please check the link in the description. Welcome back to section 2, where we will talk about human anatomy and medical words. You need to know the parts of the body so you can pick the correct codes. Medical words are like a puzzle that you must put together to understand the whole meaning. We use prefixes and suffixes to build these words, which tell us about the exact sickness. For example, the prefix cardio always means the heart in the language of the medical world. You should memorize the most common root words because they appear on the exam all the time. I know it sounds hard, but you will get better if you practice reading these terms daily. Let us talk about the skin because it is the biggest organ that the human body has. You will see many questions about cuts and burns and how to fix them on the test. When a doctor fixes a bad cut, you must measure the length to pick the right code. The rules say you have to add the lengths of simple cuts together to get one code. Do not add simple cuts and complex cuts together, because they are very different types of work. Next, we will learn about the bones and muscles, which give the human body its basic shape. Doctors fix broken bones by putting them back together, and we call this a fracture care procedure. If the doctor opens the skin to fix it, you will use an open treatment medical code. You must read the surgery notes very closely to see exactly what the doctor did that day. We also need to understand how anesthesia works when patients are sleeping for their big surgery today. Anesthesia codes are special because we base them on how much time the whole surgery takes today. You have to count the minutes from the start until the patient wakes up in the room. Every anesthesia code has a base unit value, which shows how hard the procedure is to do. You will add the base units and time units together to find out the total payment amount. Sometimes the patient is very sick before the surgery, which makes the anesthesia work much more dangerous. We use physical status modifiers to show this danger to the insurance company on the claim form. A modifier like P3 means the patient has a bad disease that causes a constant health problem. You should look at your CPT book to see the list of all these physical status modifiers. The respiratory system is another big topic that you will see on the certification exam this year. The system includes the lungs and the nose, which help the patient to breathe in the air. If a doctor puts a tube down the throat, you must look for an endoscopy procedure code. You have to read how far the tube goes to pick the right code from the book. Remember to never guess the answer, because the notes will always tell you exactly what happened there. I want you to highlight the different body systems in your code book so you'll work faster. Speed is what you need to pass the test, so organizing your books will help you win. Let us keep studying because you are doing a great job, and we are moving very fast. Your goal is to learn these basic body parts before we move to the harder surgery rules. The exam will test your knowledge of how the body works, so read your anatomy books well. We will now look at some practice questions that will test what you have learned right now. These questions are just like the real test, so take your time and think about each one. 20. What is the meaning of the common medical prefix called cardio in a patient record? The word cardio always means the heart when we are reading the doctor notes. Knowing this prefix helps you find codes for heart problems and chest pain very quickly. 21. How do you code multiple simple cuts that the doctor fixed on the exact same day? You must add the lengths of all the simple cuts together to pick one single code. The coding rules tell us to group simple repairs, so we do not overcharge the patient. 22. Can you add the length of a simple cut and a complex cut together for coding? No, you can never add different types of cuts together to make a single medical code. Simple and complex repairs require different amounts of work, so they get their own separate codes. 23. What do we call the procedure when a doctor fixes a broken bone without opening the skin? We call this a closed treatment procedure because the bone is fixed without cutting the skin. The doctor uses their hands to push the bone back into the right place for healing. 24. How are anesthesia codes mostly measured when you are billing for a big surgery in 2026? Anesthesia codes are billed by using the total time the patient is asleep for the surgery. You count the time from when the medicine starts until the patient wakes up and recovers. 25. What is a base unit value when we talk about coding for anesthesia services in hospitals? It is a number that shows how difficult the surgery is for the anesthesia doctor today. Harder surgeries have a higher base unit value, so the doctor gets paid more money for it. 26. Why do we use a physical status modifier on an anesthesia medical claim for a patient? It shows if the patient was very sick before the surgery even started in the hospital. A sick patient makes the anesthesia much more dangerous, which can change the final payment amount. 27. What does an endoscopy mean when you read a surgery note for the human respiratory system? It means the doctor put a small camera inside the body to look at the organs. You must read the note to see exactly how far the little camera went inside them. 28. What is the biggest organ of the human body that you will code in the exam? The skin is the biggest organ and it protects everything else inside the human body today. The CPT book has a very large section just for fixing problems with the human skin. 29. If the doctor removes a skin lesion, how do you know which code to use today? You have to measure the size of the lesion and the margins to pick the code. A bigger lesion means more work for the doctor, so the code will pay them more. 30. What kind of code do you use when a doctor takes a piece of skin for testing? You will use a biopsy code because the doctor is testing the skin for a bad disease. Biopsies help the doctor see if the patient has a serious problem like cancer right now. 31. What is the suffix that means to cut something out in the medical coding world today? The suffix ectomy means that the doctor cut a body part out of the patient completely. For example, an appendectomy means the doctor removed the appendix from the sick patient this morning. 32. When coding for the stomach and the intestines, which system are you looking at right now? You are looking at the digestive system, which helps the body process all the daily food. This system has codes for things like removing the gallbladder or fixing a bad stomach ulcer. 33. What is the meaning of the prefix called neuro when you see it on the test? It means the word is talking about the nerves or the brain of the sick patient. You will use these words when coding for things like a stroke or a bad headache. 34. How do you code a surgery that was stopped because the patient got very sick suddenly? You will need to add a special modifier to the code to show the stop surgery. Modifier 53 tells the insurance company that the doctor had to stop the work early. 35. What part of the CPT book lists all the modifiers that you can use for billing? You can find all the modifiers in the very front cover of your big CPT book. You should look at this list often so you do not pick the wrong modifier today. 36. When a doctor fixes a broken nose, where do you find the correct procedure code today? You will look in the respiratory system section because the nose helps the patient breathe air. Even though it is a bone, the nose is always grouped with the other breathing organs. 37. What type of codes are used to report a regular chest X-ray in a medical clinic? You will use the radiology codes to report any kind of X-ray that the doctor orders. Radiology codes are grouped by the exact body part that the machine takes a picture of. 38. What does a green stick fracture mean when you are coding for a young child today? It means the bone is bent and only broken on one side of the young arm. Children have soft bones, so they bend easily and do not break all the way through. Please leave your nice suggestions in the comment section to help us improve. You can get the full course by checking the link in the video description. Welcome back to section 3, where we will learn about the heart and blood vessels. The cardiovascular system is one of the hardest parts of the coding exam today. You must pay close attention to every small detail in the doctor's notes right now. We will look at how doctors fix blood vessels when they are totally blocked. When a patient has a heart attack, the doctor must act very fast today. They might put a small tube into the leg to reach the heart very quickly. We call this small tube a catheter, and it helps the doctor see the problem. Coding for catheters is tricky because you must know exactly where the tube finally stops. You have to read the anatomy map in your book to find the right branch. First order branches are easy, but second and third order branches take more time today. Always pick the code for the furthest point that the little tube reached inside them. Do not code the small steps if the tube goes past them to another spot. Another big topic we need to talk about is the female reproductive system coding rules. This section includes maternity care, which is how we code for having a new baby. A global maternity package includes all the normal visits before and after the baby comes. If the mother gets sick with a bad cold, you must code that totally separately. You will use a special modifier to show the cold is not about the baby. The insurance company will pay for the extra visit if you use their AAPC modifier. Now let us look at the urinary system, which includes the kidneys and the bladder. Doctors do many tests to see if the kidneys are cleaning the blood right now. If a patient has kidney stones, the doctor might use sound waves to break them. This procedure is called lithotripsy, and it is a very common question on the exam. You must check if the doctor broke the stones or removed them with a tool. Each action has a different code, so reading the surgery report is the best way. We also need to learn about the nervous system and how to code the brain. Surgeries on the brain and the spine are very complex and take a long time. Doctors often work together on the spine, so you might need to use a modifier. Modifier 62 shows that two doctors shared work on the exact same patient. You must always read the guidelines at the start of each chapter in your book. These rules tell you what is included in a code and what is left out. I want you to remember that taking your time will help you pass the test. Let us look at some practice questions to test your memory about these new rules. Always use your highlighters to mark the tricky parts in the heart and brain chapters. This trick helps you see the correct answer much faster during the real test day. Train, test, we need to fix, repeat, so you get a perfect score this year. Now we will answer 19 questions about the heart and other body systems right now. 39. What is a catheter used for when looking at the human heart in a hospital? A catheter is a tube that goes into a blood vessel to see the heart. Doctors use this small tube to find blockages and fix them to save the patient. 40. Which blood vessel code should you choose if the tube goes through many different branches? You must pick the code for the final branch that the catheter reaches inside them. The rules say you never code the smaller branches that the tube just passed through. 41. What is included in the global maternity package for a pregnant mother in the clinic? It includes the baby delivery and all the regular visits before and after the birth. The doctor gets one payment for all this normal work during the entire 9 months. 42. How do you code a broken arm if the pregnant mother falls down the stairs? You must code the broken arm completely separate from the normal baby delivery care package. Fixing a broken arm is extra work that is not part of having a baby. 43. What procedure uses sound waves to break up bad kidney stones in a sick patient? The procedure is called lithotripsy, and it turns large stones into very small safe pieces. The small pieces can then wash out of the body when the patient goes pee. 44. Why do two doctors sometimes work together on a big surgery on the human spine? The spine is very complex, so doctors need help to finish the long surgery safely. You will use modifier 62 to show that both doctors shared the hard work. 45. Where are the rules for heart surgeries located in the medical coding book this year? You will find these rules at the very start of the cardiovascular chapter in CPT. Reading these rules first will stop you from making bad mistakes on the oral test. 46. What system includes the brain and all the nerves in the human body right now? The nervous system covers the brain and the spinal cord, and all the body nerves. This section has codes for very hard surgeries like removing a bad tumor from brains. 47. How do you find the right code for a pacemaker that helps the heartbeat? You must look in the cardiovascular section and read the notes about the battery type. Pacemakers have different parts, so you must know if the Doctor changed all the pieces. 48. What does the word renal mean when you read a patient chart in the office? The word renal always refers to the kidneys and how they make urine every day. You will use this word when looking for codes in the urinary system chapter today. 49. If a patient comes for a flu shot, what code do you use for medicine? You use your own code for the medicine and a second code for pushing the needle. The insurance company needs to pay for the liquid drug and the nurse who works. 50. What does a CABG procedure do for a patient with a very sick heart today? It takes a healthy blood vessel and uses it to bypass a totally blocked artery. This big surgery helps the blood flow around the block and reach the heart muscle. 51. Can you bill a visit and a surgery on the exact same day for someone? Yes, but you must use modifier 25 to show the visit was completely separate. The visit must be for a totally different reason than the small surgery you did. 52. What is a vein compared to an artery in the human blood flow system today? A vein brings blood back to the heart while an artery takes it far away. You must know the difference, because the coding book separates them into two different lists. 53. How do you code for twins being born at the same hospital in one day? Use a special modifier to show that a second baby was born right then. Delivering two babies takes more time and more effort, so the doctor gets more money. 54. What is the main organ that cleans the blood in the human urinary system today? The kidneys are the organs that filter the blood and make urine for the body. If the kidneys stop working, the patient will need a machine to wash that blood. 55. What is the medical word for a camera looking inside the human bladder right now? We call this a cystoscopy, and it helps the doctor see stones or bad tumors. The doctor puts the camera through the natural opening so they do not cut skin. 56. When a doctor fixes a hernia in the stomach, what system are you coding from? You will use the digestive system chapter to find the codes for fixing a hernia. A hernia happens when the inside parts push out through a weak spot in muscles. 57. Why do we use modifier 50 on a medical claim for a sick patient today? Was modifier 52 show that the doctor fixed both sides of the body? If the doctor works on both left and right legs, this modifier explains it perfectly. Please leave your nice suggestions in the comment section below to help us improve today. You can get the full course by checking the link in the video description box. Welcome back to section 4, where we will talk about pictures of the human body. Radiology is the medical chapter where you will find codes for x-rays and big scans. Doctors use these special machines to look deep inside you without making any painful cuts. Sometimes the doctor uses contrast, which is a special dye to make the picture clear. If the patient drinks dye or gets it in veins, you pick a different code. You must read the notes to see if the doctor used contrast for the test. We also have the lab and pathology section to talk about in this course today. This is where doctors test the blood and urine to find the bad sickness. When you code for blood, you must know what exact panel the doctor ordered today. A panel is a group of specific blood tests that are always done together daily. You can ever unbundle tests that are already part of a single blood panel code. If you bill them separately, the insurance company will reject the whole claim very fast. We also need to look at the medicine chapter, which is near the very end. This section holds the codes for vaccines and shots that keep the patient healthy today. Remember that a vaccine needs two codes to be paid in the right way always. One code pays the office for the liquid medicine and the other pays the nurse. You will also find codes for physical therapy and eye exams in the medicine book. Modifiers are still very useful in these chapters, so you must keep them in mind. A professional component modifier shows that a doctor just read the X-ray picture right now. Modifier 26 is what you will use when the doctor reads the scan today. The technical component is for the hospital that actually owns the expensive X-ray machine today. Modifier TC means that the hospital gets paid for the power and the machine. In 2026 the rules for billing these labs have changed just a very small amount. You must be very exact when you match the sickness with the lab test ordered. Medical necessity is the rule that says a test must match the reason for visits. If the test does not make sense for the sickness, it will not be paid. Train test we need to fix repeat so you can learn all these new rules. Do not rush your reading because missing a single word can change the whole code. Use your colorful highlighters to mark the panels so you can see them very quickly. We have 19 new questions to test what you just learned in this section today. Please read each question slowly and think about the rules before you look at answers. Learning to code is a slow process, but you are getting much better every day. Practice makes you perfect, so keep reading your coding books when you have free time. This dedication will help you pass the big exam and get a very nice job. You must learn how to use the alphabetical index for looking up the medical words. The index will guide you to the right number range in the big tabular list. Never code right from the index because you might miss a very special warning note. These warnings tell you when to add another code or when to stop right there. The 2026 exam will try to trick you with these small details in the book. But you will be ready because you practiced with me and learned the secret rules. 58. What does the term contrast mean when we talk about radiology scans in the hospital? Contrast is a special dye that makes the picture look much clearer for the doctor. The dye highlights the blood vessels and the soft organs, so diseases are easily seen. 59. If a patient drinks the special dye, what type of code do you pick today? You must pick a code that says with contrast to get the correct payment amount. Drinking the dye or putting it in a vein changes the final code you select. 60. Which modifier shows that the doctor just read the picture but does not own machines? You will use modifier 26 to show the professional work of reading the scan. This modifier makes sure the doctor gets paid just for using their brain to read. 61. What does the modifier TC stand for when billing for an X-ray machine today? It stands for the technical component which pays the hospital for owning the big machine. The hospital gets this money to pay for electricity and the nurse who takes pictures. 62. What is a blood panel when you are coding in the laboratory section this year? A panel is a group of specific blood tests that are always grouped together normally. You use one single code for the whole panel instead of billing every test alone. 63. What happens if you unbundle the tests in a blood panel to make more money? The insurance company will deny your claim because unbundling is strictly against the coding rules. You must follow the rules to avoid big fines and keep the patient bills fair. 64. In the medicine chapter, how do you bill for a regular flu shot this morning? You must bill one code for the medicine and another code for the nurse injection. Both parts are required to show the full cost of giving the vaccine to patients. 65. What does the rule of medical necessity mean when you order a lab test today? It means the sickness must match the test so the insurance sees it makes sense. You cannot test a patient for broken bones if they just have a simple cough. 66. Where do you find codes for eye exams and glasses in your big coding book? You will find the vision codes inside the medicine chapter near the end of CPT. This section handles special services that do not fit in the main surgery chapter today. 67. If a doctor uses sound waves to see the baby, what is the scan called? This safe picture is called an ultrasound, and it does not use any bad radiation. Ultrasounds are safe for pregnant mothers and help the doctor check the baby very well. 68. What is the pathology chapter mainly used for in a busy medical clinic right now? It is used to code the testing of human tissues to find out about cancer. A doctor called a pathologist looks at the tiny skin cells under a big microscope. 69. How do you code a qualitative drug test for a sick patient in the clinic? You code it to show if the bad drug is just present in the blood. Qualitative tests only give a yes or no answer about the drug in the body. 70. What does a quantitative drug test tell the doctor about the patient in the room? It tells the doctor the exact amount of the drug that is in the blood. This test is more complex because it measures the specific numbers for the doctor today. 71. What is the purpose of the alphabetical index in the medical coding books you use? The index helps you find the right number range before you check the tabular list. You must start in the index to save time, but never pick codes from there. 72. Why should you never pick a final code directly from the alphabetical index book today? The index is missing important warnings and extra rules that are in the tabular list. Picking from the index is dangerous and will cause you to fail the real test. 73. What is a screening test when looking at the pathology chapter in the medical book? A screening is a test for a healthy person to catch a disease very early. Doctors do screenings before the patient feels sick so they can save their life easily. 74. How do you code for a patient who gets physical therapy for a bad back? You will find the physical therapy codes in the medicine chapter of the CPT book. Therapy codes are often based on the time the therapist spends helping patients stretch. 75. What modifier do you use when a test is repeated by the exact same doctor? You will use modifier 91 to show the lab test was repeated that day. This tells the insurance company that the second test is not a duplicate billing error. 76. In 2026, how do you stay fast during the exam while checking the big books? You must use tabs and highlighters to mark the most important pages in your books. Practicing with these marked pages helps you find the right answers in just a minute. Please leave suggestions in the comment section to improve. To get the full course, check the link in the description. Welcome back to section 5, where we will study the rules for injuries and accidents. You will see many questions about how patients get hurt in the real world today. We use special codes to tell the story of how the accident really happened. These codes are called the external cause codes in the big ICD-10 CM medical book. You must use these codes to show if the patient fell down or was hit. They also tell the insurance company where the accident happened, like at home or work. Work accidents are very important because a different insurance company might pay for the bills. You only use these external cause codes when the patient comes for the first time. Do not use them for the follow-up visits when the patient is getting better. We also need to talk about burns because they are very tricky on the exam. Burns have different degrees, like first, second, and third, depending on the skin damage. You must always code the worst burn first on the claim form. If a patient has a third-degree burn on the arm, that goes first. The rule of nines helps the doctor measure how much skin is burned. You will use this rule to find the percentage of the body that is hurt. It is an easy math trick that saves you a lot of time. Let us move on to the healthcare rules. You must know the difference between fraud and abuse in the medical office. Fraud is when you lie on purpose to get more money from the insurance company. Abuse is when you make a mistake that costs money but was not planned. Both are bad, but fraud can send you to jail for years. Always double check your codes to make sure they match the doctor's notes. Train, test, wane to fix, repeat so you do not make these mistakes. Medical coding requires you to be honest and protect patient records. Another topic you must learn is how to code for patients who have diabetes. Diabetes affects many body parts, so the codes are complex. You must read the notes to see if the patient takes insulin shots every day. If they do, you must add an extra code to show this fact. The 2026 exam will check if you know how to sequence these diabetes codes correctly. Sequencing means putting the codes in the right order. The main sickness is always listed as the first code, and extra conditions follow to give the full picture. We will now look at 19 new questions to help you practice. Take a deep breath and read each question slowly so you do not miss words. You are learning so much, and I am proud of your hard work today. 77. What are external cause codes used for in the ICD-10-CM coding book today? They are used to tell how and where an accident or injury happened to someone. These codes give the insurance company the full story about the bad accident and injury. 78. Do you use an external cause code for a patient's follow-up visit today? No, you only use them for the very first time the patient sees the doctor. After the first visit, the insurance company already knows how the bad accident happened there. 79. What does the rule of nines help a medical coder do in the clinic? It helps the coder measure the percentage of the body that has bad skin burns. This math rule splits the body into sections of 9% to make counting easy. 80. If a patient has multiple burns, which one should you list first on the claim? You must always list the burn with the highest degree as the first medical code. The highest degree burn is the most serious problem and requires the most medical work. 81. What is the difference between a first degree and a third degree burn today? A first degree burn is mild, but a third degree burn destroys the deep skin. Third degree burns are very dangerous and often require a big surgery to fix them. 82. What does it mean when a coder commits fraud in a busy medical office? Fraud means the coder lied on purpose to steal extra money from the insurance company. This is a crime that can lead to big fines and losing your professional job. 83. How is medical abuse different from medical fraud in the healthcare billing system? Abuse is a mistake that costs money, but it was not done on purpose today. Abuse is still bad, but it happens because the coder did not know the rules. 84. Why do you need an extra code if a diabetic patient takes insulin shots? The extra code tells the insurance company that the patient requires long-term drug management. Insulin use shows that the sickness is harder to control and needs more doctor visits. 85. What does the word sequencing mean when you fill out a medical claim form? It means putting the diagnosis codes in the exact right order on the paper form. The most important reason for the visit must always be the very first code listed. 86. What should you do if the doctor notes are messy and hard to read? You must ask the doctor to fix the notes before you pick any medical codes. Guessing the code is wrong, so you must wait for the doctor to clarify things. 87. Can you code a condition that is completely resolved and gone from the patient? No, you cannot code a sickness that the patient does not have anymore today. You should only code the active problems that the doctor is treating right now today. 88. What is a late effect when coding for injuries in the ICD-10-CM Big Book? It is a new problem that happens because of a very old injury or sickness. For example, a scar that hurts years after a burn is called a late effect. 89. How many codes do you need to report a late effect properly this year? Usually need 2 codes to show the new problem and the old cause together. This helps tell the complete story of why the patient is feeling bad right now. 90. What is an adverse effect when a patient takes their medicine the right way? It means the patient had a bad reaction even though they followed the doctor rules. Sometimes regular medicine makes people sick and you must use a code for this reaction. 91. How do you code a poisoning if the patient takes too much medicine accidentally? You must use a poisoning code to show that the dose was totally wrong today. Poisoning codes explain that the medicine was taken in a way the doctor did not say. 92. What part of the ICD-10 book helps you find the codes for bad medicine? You must use the table of drugs and chemicals to find these exact medical codes. This table lists all the drugs and shows if it was an accident or poisoning. 93. Why is it important to code the exact place where an accident happened today? It shows if the accident happened at home or at a busy workplace today. This helps decide if the regular insurance or the work insurance will pay the bill. 94. What code do you use if the patient is just visiting for a checkup? You will use a Z code to show the visit is for a healthy person. Z codes explain the reason for the visit when there is no active sickness today. 95. How often do the medical coding rules and the big books change for us? The books and the rules change every single year to add the new medical discoveries. You must buy new books and learn the new rules every year to stay smart. To get the full course, check the link in the description. Welcome back to section 6, the very last part of our big coding course today. I am very proud of the hard work you have put into studying with me. We will talk about HCPCS, which is the last book you need for the test. This book has the codes for things like ambulances and special drugs for sick people. You will see that HCPCS codes always start with a letter and then 4 numbers. For example, a J code is used to bill for drugs given in the office. You must know the exact amount of the drug to pick the right J code. If the doctor gives a little extra medicine, you might need to bill twinets. We also need to review the rules for keeping patient information totally safe and private. HCPCS, the big law that stops us from sharing medical secrets with bad people. If you leave a medical file on your desk, someone else might see the secrets. You must always lock your computer screen when you leave your desk for a break. When you take the exam, you will feel nervous, but you must trust your studying. Read every single question twice to make sure you do not miss a trick word. Sometimes the test maker adds extra words that do not change the final medical code. You have to learn how to ignore the extra words and just find the procedure. If you get stuck on a very hard question, just skip it and move on. You can always come back to the hard questions when you finish the easy ones. Time is your biggest enemy on the test day, so you must work very fast. Train, test, we need to fix, repeat, is the way you will win this year. Always check your code against the tabular list so you know the rules are met. Never guess a code, because guessing will make you fail the big test very quickly. You have learned so much about the human body and the rules of medical billing. I know you will be a great medical coder when you get your new job. We also need to remember the rules for coding a new patient in the office. A new patient has not seen any doctor in that exact office for 3 years. If they saw a different doctor in the same group, they are an established patient. Established patients are faster to code because the doctor already knows their whole health history. When you pack your bags for the test day, make sure to bring your books. You cannot share ebooks with any other student who is taking the test that day. Bring a big bottle of water and some snacks to keep your brain working hard. Take a deep breath before you start the test and believe in your own brain. The proctor will tell you when to start the test and when to stop writing. Do not look at the other students because the proctor might think you are cheating. Just focus on your own paper and the codes you have marked in your books. Now we will do the last set of questions to finish your final test prep. You should also practice coding for long surgeries that take many hours to finish up. Sometimes the doctor needs an assistant to help hold the heavy tools in the room. You will use modifier 80 to show that an assistant helped the main doctor today. The assistant gets paid a smaller amount of money for helping with the big surgery. I am so happy that we finished this long journey of learning all these codes. You are completely ready to take the exam and pass it with a high score. Keep practicing until the day of the test so you do not forget the rules. We will answer 19 final questions right now to test your memory one last time. 96. What does AJ code, inside the HCPCS book usually, stand for in medical billing? AJ code is mostly used to bill for special, liquid drugs in the office. The doctor uses these codes, when they give a drug, through a needle to patients. 97. What is the big law, that keeps all the patient, medical files safe and private? The big law is called HIPAA and it protects the secrets of every sick patient. If you break this law, you can go to jail, or lose your coding job. 98. How long does a person wait to be considered a new patient in the clinic? They must wait exactly 3 full years without seeing any doctor in that exact office. If they come back before 3 years, they are billed as an established returning patient. 99. What do you do if you get stuck on a hard question during the test? You should skip the hard question and come back to it after the easy ones. This helps you save your time so you can finish the whole exam very quickly. 100. Why does the test maker put extra words inside the long surgery question text today? They add extra words to trick you and see if you really know the rules. You must read carefully and only code the work that the doctor actually finished today. 101. What does modifier AD mean when it is attached to a big surgery code today? It means that a second doctor helped the main doctor during the very long surgery. The assistant doctor gets a little money for holding tools and keeping the patient safe. 102. When should you use modifier 59 on a medical claim for the insurance company? You use it to unbundle 2 codes that are usually stuck together in the rules. This modifier proves the doctor did extra work on a totally different part of bodies. 103. Why is modifier 25 so important for a new medical coder to learn perfectly? It lets the doctor get paid for an office visit and a small surgery together. The visit must be completely separate from the surgery to be legal and paid right. 104. What is the best way to learn all the new rules for the 2026 test? You must read the guidelines at the start of every chapter in your code book. Reading the rules prevents you from making bad mistakes that will cause you to fail. 105. Can you share your coding books with a friend during the real certification test today? No, you can never share books with anyone else in the quiet testing room today. You must bring your own books with your own special notes written inside the pages. 106. What should you do right before the test starts to calm your very nervous brain? You should take a deep breath and trust all the hard work you have done. Feeling calm will help you read the questions better and pick the right answers fast. 107. What type of codes are used to bill for an ambulance ride to the hospital? You will find the ambulance transport codes inside the big HCPCS Level 2 medical book. These codes explain how the sick patient was moved safely by the emergency medical team. 108. Why do established patients have different office visit codes than brand new patient shave today? The doctor already knows the medical history of the patient, so the visit is faster. New patients require much more time to learn their history, so they pay slightly more. 109. What is a trick to find the right code quickly during the fast-paced test? You should use colorful highlighters and tabs to mark the most helpful pages in books. This strategy stops you from wasting time turning empty pages when you're very rushed. 110. Can you guess a code, if you do not know the right answer at all? You should never guess without checking the tabular list in the main part of books. Guessing is dangerous because the index can easily point you to the wrong number range. 111. What is the main reason why the rules change every single year for the coders? The rules change to match the new diseases and the new surgeries that doctors invent. You must buy new books every year, so you do not bill with broken codes. 112. How does the coder know exactly how many units of a drug to bill today? The coder must read the doctor notes to see exactly how much liquid was pushed. You then divide the total liquid amount by the number listed in the code book. 113. What should you do if the doctor leaves a blank space in the surgery report? You must ask the doctor to fill in the blank space before you pick codes. A coder can never add details to the medical record without the doctor helping them. 114. Why is medical coding such a great career choice for smart people in the world? It is a great job because you help patients and solve medical puzzles every day. You will always have a good job if you keep learning the new rules yearly. Please leave your nice suggestions in the comment section below to help us improve today. You can get the full course by checking the link in the video description box.